I'm Wolf Blitzer. This is CNN.
Our third story out front, Corey Monteith's deadly cocktail. According to the toxicology report that came out today, the 31-year-old star from the TV show Glee died from an overdose of heroin and alcohol early Saturday morning. Canadian officials say there's no evidence to suggest Monteith's death was anything other than a tragic accident. Sanjay Gupta is out front. And Sanjay, why is that particular combination? When you can take alcohol or heroin on their own, both of them can be very lethal, but the combination?
What happens with both these drugs, and heroin is sort of a morphine derivative, and what we know about morphine derivatives as well as alcohol is they both affect your central nervous system. So think about your body. It's constantly doing things that you don't have to think about. Your heart is beating on its own. Your drive to breathe is there on its own. When you start to suppress the central nervous system, because
those things stop too.
In combination, yeah, your breathing, your drive to breathe sort of stops. So the typical tragic scenario is that someone taking these substances, they fall asleep, and then their drive to breathe stops. And that's, you hear about this with Michael Jackson, you hear about those countless other cases. That's the typical situation.
Wow, which is so frightening because you just don't realize it. Now, Corey Monteith, he had problems, right, with addiction. He had just finished a rehab cycle. I don't know what the right word might be, but back in March. So how common is it for a person to relapse so quickly?
Heroin is probably the most addictive substance on the planet. And so it is incredibly common. And it's very hard to even come by data, Aaron, in terms of relapse rates. I think what most addiction experts will say is, look, it's not a failure if you don't get, if after one stint of rehab you relapse. People often go through multiple stints in rehab. But it is one of the most addictive substances. And keep in mind, we're talking about heroin and alcohol, which either one of them in too high a dose could potentially lead to death.
Right.
But when it comes to prescription drugs, painkillers, these derivatives, someone dies in this country every 19 minutes of an accidental prescription drug overdose. So,
meaning sleeping medications and things like that.
Yeah,
or
pain pills, things like that. And
every 19 minutes.
Every 19 minutes. And oftentimes it's because they combine it with alcohol. It's easy to get, it's legal, and oftentimes it's a drug of choice. It's combined with some of these other things.
All right, so the night before Monteith died, he was out to dinner with his manager, with another friend, and a friend described him as, he looked so good and so healthy. Those were the words. And when you think of someone who's an heroin addict, you don't generally think of they look so healthy, right? But that's what they said. Would family and friends have picked up any signs that he was on such a dramatic downward spiral?
It is so hard, in part because someone who is actively using and someone who may be actively withdrawing, they may look very similar. So, it could be that they're both in a terrible sort of state, or they could both seem like they're actually in a pretty good place. So it can be really hard to tell sometimes. Some of the character traits where they're not eating as well, they're not sleeping as well, behavioral changes, those things, you look for those.
For someone who's getting better or getting worse.
Or getting worse, and that's part of the problem.
Wow.
What a lot of addiction specialists will say as well is that, look, there's probably people around who may have a pretty good idea just because they know him well, they're interacting with him on a regular basis. But you find even the closest friends sometimes just don't know for sure.
Right. Well, and maybe they don't want to, so you don't look, because you don't want to see what it is.
Yeah.
All right. Dr. Sanjay Gupta, thank you. And still to come, the Trayvon Martin movement. Protests continue.